We are talking about the autosomal dominant disorders. First, we know what is autosome. What is autosome? Human has 23 pairs of chromosome. 23 pairs of chromosome. These 23 pairs of chromosome, the 22 pairs is autosome, and one pair is called 6 chromosome. Chromosome. This one pair of 6 chromosome is called X chromosome and Y chromosome. In the male, there is X and Y, both type of chromosome. One copy of each, one copy of X chromosome and one copy of Y chromosome. This is called chromosome in the male. In the female, there is 2 copy of X chromosome, XX, 2 copy of X chromosome. This is called female chromosome. So the autosome are the chromosome without 6 chromosome. There are 22 pairs of autosome, 22 pairs of autosome. Now we will discuss about the autosomal dominant, then we will discuss about the autosomal recessive disorders. The autosomal dominant disorders are manifested in the heterozygous states. They are manifest in the heterozygous states. The state for the autosomal dominant is the heterozygous state. Heterozygous means, what is heterozygous? Heterozygous means either mother or father was mutation in the autosome. They represents is heterozygous state. So at least one parent of the intake case is usually affected. So either mother or father of the autosomal dominant patient was affected. One was affected. Either mother or father was mutation in the autosome and this was affected. One of their parents was affected. Either mother or father. That is one of either parent was affected and there was mutation in the autosome. Both the males and females can be affected. The offspring, in the offspring, this was the offspring. In the offspring, both male and female can be affected equally. Both male and female of the parent can be affected equally. And these both male or female can transmit this disease to his offspring. These both male and female can transmit this disease to the offspring. Why? So we discuss the concept. When the fertilization occurs, there is one chromosome taken from the male, either X chromosome or Y chromosome, and one chromosome taken from the female, either X chromosome or this X chromosome. So this is not the chromosomal disease. This is the autosomal disease or an autosomal dominant disorder. Dominant means each copy has 2 alleles. Each copy has 2 alleles. For example, A and A. This indicates the dominant alleles. Dominant alleles. And this is, for example, A, smaller a. This indicates the dominant. This indicates the non-dominant allele. Non-dominant alleles. So this is the autosomal dominant disorder, not the autosomal recessive disorder. So both male offspring or female offspring has the equal ratio to transmit this disease to his offspring, because this is not a chromosomal, this is autosomal, and this is the dominant disorder. For example, if this autosome is abnormal, if that is taken from the father and the father was affected of the individual. For example, this is the abnormal autosomal mutation in this, and this is taken from the mother. For example, this was of the mother. So one can be taken from the father and one can be taken from the mother. So for example, if the father was affected, so there is A dominant and one from mother, A recessive. So when the dominant are present or the recessive are in silent state, the dominant act and they play a role. So if this can be girl or boys of the offspring of the father that was affected from the disease, that was affected So that are present in this region because this was the autosomal, not the sex chromosomal disorder. In other case, if there was one allele for mother, for example, this was infected. This allele was mutation in this allele. So one carry from the father and one from the mother. One carry from the, for example, this taken from the mother and this from the father. So the baby or the offspring can be affected because this is not the sex chromosome disorder. This is not the sex-linked disorder. This is autosomal dominant disorder. In the autosomal dominant disorder, the both male or females are affected, and at least one of their parents is affected from the disorders, and this transmit the disease equally to the offspring. This transmit the disease equally to the offspring. With every autosomal dominant disorder, some proportion of the patient do not have affected parents. In some cases, the patient father or mother are not be affected. Such patients say that they have new mutation involved in their eggs or in their sperms because the autosomes are the chromosome, but not the sex chromosomes. There are also cases, but in these cases, their siblings are neither affected nor at increased risk for the diseases. Some parents says that they have mutation in the eggs. They have mutation in the eggs or sperms mutations, and this parents either of parents was not affected. Either of parents was not affected. They say that have mutation in the eggs and sperms during the spermatogenesis, and the parents was not affected. Either parents was not affected. Not affected. So this sibling is also not affected. And they don't transfer this disease. According to this situation, they don't transfer this disease. The transfer of the disease occurs when either of these two parents was affected, so they carry the disease. When the parents not affected, this not carry the disease. Now we discuss a few examples about the autosomal dominant disorders. The disorder detail we have already explained in other lecture. Now we only discuss the names of these disorders. The disorder in the neuron, for example, neuron related, that is CNS disorders, that was autosomal dominant. That is Huntington disease in neurofibromatosis. Huntington disease, there is a mutation in the Huntington gene. In neurofibromatosis, this was the autosomal dominant disorders. The myotonic dystrophy and tuberous sclerosis also autosomal dominant disorder. Myotonic dystrophy. The detail of this disorder we will discuss in other lecture. Myotonic dystrophy and tuberous sclerosis. Huntington disease is an example of autosomal dominant disorder. Neurofibromatosis is an example of autosomal dominant disorder. This is the neuron disease. Huntington disease, neurofibromatosis, myotonic dystrophies, tuberous sclerosis. This is the neuron disease of the autosomal dominant type. That is Huntington disease, neurofibromatosis. There are two types: neurofibromatosis type 1 and 2, and tuberous sclerosis and myotonic dystrophy. This was the example of autosomal dominant disorders that affects the neuron. Now we will discuss the urinary and other system disorders that are autosomal dominant. Urinary system. Autosomal dominant disorder in the urinary system. The autosomal dominant disorder in the urinary system, the best example is polycystic kidney disease, PKD. We have PKD, polycystic kidney disease. There are PKD1 and PKD2, and mutation in the PKD1 and PKD2 genes. This is also autosomal dominant disorders. The gastrointestinal disorders are familial polyposis coli. The GIT disorders are familial polyposis coli. Familial polyposis coli. This is the gastrointestinal disorders. Now we will discuss the hematopoietic disorders that related to autosomal dominant. Hematopoietic disorders. The hematopoietic disorders that are related to the autosomal dominant disorders. Hematopoietic disorder example is hereditary spherocytosis and von Willebrand disease. Hereditary spherocytosis and von Willebrand disease. Von Willebrand disease and hereditary spherocytosis are the hematopoietic disorders that are autosomal dominant disorders. The type is autosomal dominant. Now we will discuss the skeletal types of disorder in the autosomal dominant fashion. The skeletal disorders is skeletal disorders that is autosomal dominant. The skeletal disorder is Marfan syndrome, Ehlers-Danlos syndrome, and osteogenesis imperfecta and achondroplasia. There are disorders called Marfan syndrome is autosomal dominant. Marfan syndrome is autosomal dominant skeletal disorders. Also Ehlers-Danlos syndrome, Ehlers-Danlos syndrome. Ehlers-Danlos syndrome also called osteogenesis imperfecta. Also called osteogenesis imperfecta. Osteogenesis imperfecta. Osteogenesis imperfecta. Another is achondroplasia. Achondroplasia, osteogenesis imperfecta, or Ehlers-Danlos syndrome and Marfan syndrome are the skeletal system disorders that are autosomal dominant. We discussed a few words about this disorder in the next lecture. Now only we will discuss the list of these disorders that are autosomal dominant. The metabolic disorders are autosomal dominant. Example is familial hypercholesterolemia and acute intermittent porphyria. Metabolic in origin, metabolic disorders that are autosomal dominant. Example is familial hypercholesterolemia. Familial hypercholesterolemia. Familial hypercholesterolemia. There is familial disorder, there is hypercholesterol level, and this is the autosomal dominant disorders. Another example is acute intermittent porphyria. Acute intermittent porphyria. Familial hypercholesterolemia, and acute intermittent porphyria are the metabolic disorders that is autosomal dominant in origin.